I'm Tom Morello, and you're listening to the Ralph Nader Radio Hour.
Stand up, you've been sailing way too long.
Welcome to the Ralph Nader Radio Hour. My name is Steve Scrovan, along with my co-host David Feldman. Hello, David.
Good morning. Very important show today.
That's correct. And to help us get through it is, of course, the man of the hour, Ralph Nader. Hello, Ralph.
Hello, everybody. You're right, David.
And we wanted to open the show with another tribute. We seem to be doing this a lot lately. And this is particularly poignant for us because this person was a guest on a recent show just 3 weeks ago. Her name is Hazel Henderson, a remarkable woman with a remarkable history. And Ralph, you were an ally with her for many years. Why don't you talk about Hazel, who passed this past week?
This was a real tragic loss. Very courageous. She did the show a few weeks ago, even though she was in pain from her ailments, and she passed away a few days ago. There will be obituaries in the major newspapers, to be sure, here and abroad. And she was a spectacular, ground-up political scientist that redefined measurements of economies as if people mattered first, not corporate profits, corporate buybacks, corporate dividends, or corporate bonuses. So she challenged the GDP yardsticks because she realized that if you control the yardsticks, the way the SAT does, for example, and the way the GDP corporate economists do, you control the dialogue. You control what is said, and you make sure what is not said. So she says, for example, how can you measure an economy without talking about air pollution, child poverty, lack of infrastructure? How can you talk about GDP without talking about climate devastation, the depletion of natural resources, the cutting of the equatorial forest? And there's nobody that could match her on the corporate side. She was often right too soon on too many things. Therefore, she was excluded mostly from the mainstream media. How'd she react? Created her own international media, syndicated columns translated into 27 languages. She had her own early webinars, books, articles, conferences, wrote for the Harvard Business Review, consultant to the Office of Technology Assessment of Congress, and she never got an economics degree. Completely self-taught, sparked by an experience in New York City, in Manhattan, when she watched the soot from the air pollution in the 1960s build up on her windowsill. And she would walk out, and it would be hard to breathe on some days. So she called up the mayor and the city council. What's going on here? Why aren't you doing something about it on these incinerators and trash burning facilities? Started a clean air organization in New York City, and then there was no stopping her. She was on all kinds of groups, boards she created. She was a tremendous booster of free thinking as if people mattered, whether it was technology, peace, sustainable energy. She called the sun the Earth's most neglected resource, one of the historical free lunches of all time. Instead of digging up fossil fuels and burning the world up with pollution and occupational dangers and climate change, she said, we have to respect what the sun is giving us every day that we're not using and applying. And her great book, The Politics of the Solar Age, influenced a lot of young people. And it came out in 1981. That's 41 years ago. And there were many other books. She wrote a book on achieving peace. She wrote books on technology. She was an excoriating critic of Silicon Valley and how they're addicting millions of people and preying on the young. Her work will continue. She was prescient and started a trust, and she has groups of people who are going to continue her work, including from her home in Florida, where she has a 9,000-volume library that she was very proud of, and her legacy will continue. Hazel Henderson, what a marvelous human being, self-taught, 90 years on Earth, and making a difference.
Thank you for that, Ralph. And I encourage everybody to go to ralphnaderradiohour.com. It's just from a couple of weeks ago. We interviewed her, and you would have no idea, and when you listen to her voice and her energy, that she was so close to the end. She was a force right into the very end, a role model for all of us. So thank you for that, Hazel. Up first today, we'll welcome back our friend of the show, Dr. Michael Osterholm. Dr. Osterholm is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He's a frequent consultant to the World Health Organization, the National Institutes of Health, the FDA, the Department of Defense, the CDC, and the Ralph Nader Radio Hour. In fact, back in 2018, the prescient Dr. Osterholm came onto our program to talk about his New York Times opinion piece entitled, "We're Not Ready for a Flu Pandemic." That's why you have to listen to the Ralph Nader Radio Hour, people. We're always ahead of the curve. At a time when reliable information about the current state of the pandemic is becoming harder to find in a sea of snake oil and misinformation, Dr. Osterholm will join us to discuss the current state of the COVID-19 pandemic in the United States and around the world. After that, we'll be joined by Dan Xie, the political director at Student Public Interest Research Groups, or Student PIRGs. Student PIRGs provide the training, professional support, and resources that students need to advocate for social change. So far in 2022, Student PIRGs have achieved remarkable success lobbying for their legislative priorities, which include climate solutions, hunger-free campuses, prescription drug prices, reducing plastics pollution, making college textbooks affordable, and more. We're going to go all through that with her, and we'll ask Dawn about the work Student PIRGs are doing in nearly 100 campuses in 25 states. As always, somewhere in the middle, we'll check in with our corporate crime reporter, Russell Mokhiber. But first, let's check in with Dr. Michael Osterholm for the latest on the COVID-19 pandemic. David?
Dr. Michael Osterholm is a professor and director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He is the author of Deadliest Enemy, Our War Against Killer Germs, and he has a weekly podcast called the Osterholm Update, COVID-19. Welcome back to the Ralph Nader Radio Hour, Dr. Michael Osterholm.
Thank you. It's a real honor to always be with you. I appreciate it.
Well, Michael, as many of our serious listeners know, you were very early on, years ago, in warning about the coming of these pandemics in great detail as a leading infectious disease specialist. You also warned about how unprepared we were and how our public health budgets were being subordinated to other federal budgets that didn't have anything to do with saving lives. So with that background, I want to try to cover a lot of ground for our listeners, because with the recent upsurge of the variants and the COVID-19, they've got questions that are deeply concerning that they want answered for their own health and safety. You're quoted in the Washington Post recently as saying, quote, "Every day I wake up, I fear there will be a new subvariant that we will have to consider. We're seeing subvariants of subvariants," end quote. So my first question is, what do you think people should do voluntarily to reduce their exposure and their communicating a contagion to other people? And what do you think public health officials should mandate, as they have in past highly contagious epidemics in our country's history?
Well, first of all, Ralph, I have to say that I'm disclosing to you that I probably know less about this situation today than I did 4 or 5 months to a year ago. The more we learn, I think the less clear it all becomes. But let me just take a page out of what I guess I would just call rational human behavior. The public is done with this pandemic. They're done. They are not going to agree to do much unless they feel a unique vulnerability. And that means that they'll be fully vaccinated. They will wear their N95 respirators because they're concerned that if they get infected, they could have serious illness, be hospitalized and even die. For the vast majority of the public, I don't know it matters what we say. They are going to do what they're going to do. And I think from that perspective, then we have to think about, so then what does that mean for the pandemic and what's going to happen? And you put that together with the fact that these new variants and these new viruses just keep coming at us, I think there's just a great deal of uncertainty about what can and should be done. I worry about the President of the United States every day. I watch him out there in the public settings without any respiratory protection, knowing that, he's been fully vaccinated. He'll have access to good medical care. But, if anybody should be protected right now, it's an individual in his 70s like that. And if you have that kind of an example, I don't think many other people are going to feel like they should do much more than they're doing.
What would you say to people who have open mind and they're very concerned, they want your advice?
Well, I again come back to what I do. And what I do basically is when I'm in public settings right now, is we see this big increase in transmission. And we are seeing right now probably as much transmission as we have in any time in the pandemic. It's a milder disease, I grant you. The good news is we're talking about fewer deaths, but we're still talking about 350 deaths a day, which is, several thousand a week. It's not like the big surges before. But so I think for the vast majority of people who will get COVID, they will have a milder illness, flu-like illness. But the challenge is those who are at high risk for serious illness still are going to be that way, and they should be masked. The second thing is, even if you do get the milder illness, we're seeing clearly anywhere from 10 to 20% of these people are going on and developing long COVID. This condition of lasting months, if not even longer, where, brain fog, fatigue, cardiac problems, lung problems. Ralph, I don't want to get long COVID. And so it might not kill me, but at the same time, it surely sets us back. So then again, that's where I'm back to being as fully vaccinated. And when I'm in public settings, wearing that N95 respirator.
How about a first and second booster?
Yeah, I very strongly support that. The challenge is, and it really is a challenge, is I don't know where we go from here. I currently lead a group. I chair a major effort from our center funded by the Rockefeller Foundation and the Gates Foundation with support from the Wellcome Trust to actually develop what we call a pan-coronavirus vaccine roadmap. We know that the vaccines we have now have been remarkable, but they're not perfect. They're not perfect at all. We need 2.0, 3.0, 4.0 vaccines. And so the challenge we have is they're not going to come overnight. And right now, when you ask the question about the boosters, I'd say absolutely get those second two. But we're already beginning to see the fourth booster begin to wane in its protection against serious illness, hospitalizations, and deaths. We can't keep boosting our population every couple of months. First of all, people won't do it. Right now, when you look at those who have received 2 doses of vaccine, only about 35% of those people have gotten the third dose that was recommended, and that was strongly recommended. And these are not vaccine hostile, they're not vaccine hesitant people, they just won't get it. So you can't make somebody do something like that if they don't want to. And so our only best bet is to try to find new and better vaccines that hopefully will give us longer protection, better protection, and not require, a booster every so many months after the previous booster.
What about the therapeutic drugs? There's one by Pfizer and others. Are they worth considering?
Oh, absolutely. I can tell you right now, if I did get infected, Ralph, the first thing I'd want to do is be treated with the drug that Pfizer puts out, the Paxlovid. It's not a be-all, end-all. We do see breakthrough infections with it, meaning that some people will do better while on the drug and then a few days later have somewhat of a rebound effect. But we're looking at that carefully right now, and it may be that just you need a longer treatment rather than 5 days. But the evidence is clear and compelling that particularly for high-risk individuals, that drug and the 5 days of treatment that you get with it can greatly reduce the risk of hospitalization, serious illness, and deaths.
Does this mean right after you test positive or after
yes.
you
No, right away,
symptoms?
right away. You don't want, you if you test positive, you should, and you're in high risk, you should be treated. In fact, you have 5 days from the time you basically become symptomatic or infected to get treated. That's what the data shows. It makes a difference. If you wait beyond that, the ability to reduce illness is substantial. So yes, get it right away. Don't wait until you become sick or particularly even severely ill. Get it as soon as you can.
How reliable are the tests now, given all the variants and subvariants?
Well, on the PCR testing, they're quite reliable. The problem with that is that we have cut way back on that. And we're not the only country. I mean, those individuals in the United Kingdom had an amazing program set up there for testing and sampling. And, the world's moved on. The pandemic's over in the minds of most. And so we've cut way back on testing capabilities with PCR. What we're now doing is encouraging people to use these home tests, what we call lateral flow tests. They're not nearly as sensitive. You can go literally for days being clinically ill and test negative and, to only turn up positive on your 5th or 6th day. So, we need to clearly look at this whole testing issue. We want people to know so that they don't, in fact, go out and expose others, but also because they then can access this drug that can help keep them from becoming a hospitalized patient. So the tests from a PCR standpoint are great. Good luck finding one. From the home testing standpoint, they're okay, but they're not what we see with PCR.
One question we get with some frequency are people saying, should I be scared of going to my doctor or dentist's office on non-COVID necessities and pick it up from there? Is there any data or studies showing whether doctors, dentists' offices, and hospitals are contributing to the spread?
Well, first of all, as you have so well defined over a lifetime, and I've been one of your students listening to that, life is a risk. And the question is, how do you parse that risk out to what you do and don't do? Right now, there is a real risk for people who are not seeking medical care for any number of other conditions. We're already beginning to get the evidence that, for example, people have postponed diagnostic testing with potential cancers that are going to really be a tragedy going down the road because these cancers were caught so late in their actual occurrence. So if you need medical care, you should go get it. The vast majority of healthcare facilities in this country are doing everything they can to minimize the potential for exposure in the office to both you and other patients, but also you and the employees. And so I feel confident that in a risk benefit, if I thought I had a condition that I really needed to be seen for, and including pain, we unfortunately allow people to live in very painful situations that they don't necessarily have to. I would definitely go in and be treated. Same as with my teeth. Dental practices have worried about aerosols or these kind of fine particles in the air long before COVID, because when they're working in someone's mouth, they often, with high-speed drills, et cetera, that happens. So I'm confident that way. I have not stopped at all from seeing my own medical care provider. I do wear my N95 there. I don't take it off unless I absolutely have to in the exam room kind of situation. And so please don't be afraid to go. But don't also be afraid to ask before you go what the office is doing or the clinic to protect you and to protect the workers and other patients. And I think most times you'll find a quite satisfactory answer, and that's what you want to do.
Is the N95 mask that wraps around your head a plus beyond the normal N95 that's just around your ears?
Yeah, well, first of all, just to understand what respiratory protection is all about, there are two really, really key features. One is fit and the other is filtration. The fit, imagine it's like swim goggles. If I may have the most expensive pair of swim goggles in the world, but if they leak at the fit, what good are they? And so one of the challenges we have is for a lot of the respiratory protection, they don't have a tight fit, and air can come in and out. Particularly as you blow in and out, you actually, in a sense, create an opening at the skin interface. By the way, a note that most men don't want to hear, but for those who have beards, they don't get any kind of fit at all. They are very poor fits, and air just goes in and out of the sides there. In terms of filtration, what makes N95s so unique, and the KN95s, the kind that you're talking about with the behind the ear, which I'll come back to in a moment, is that the material is called a milk-blown material. It's actually not, in fact, like paper or whatever. It's actually blown out and hardens, so like a resin material. And it has an electrostatic charge in it, so that the pore spaces are big enough to allow air to come in and out, like the filter on a furnace. But the charge then traps the virus coming through. You want it big enough so you can breathe easily. You don't want to suffocate in the darn thing. And that's why a lot of people say, well, I'm going to wear my cloth mask because I can breathe easier. Well, if you can breathe easier, then you also know you got a lot of leakage. So in an N95 or a KN95, what you have happening is you got the tight fit, but you got breathability going back and forth. Now, when you asked about the ear loop piece, some of the KN95s and what we call KN94s from Korea in particular have that. And in fact, there is a couple of companies in the United States that make them that are not considered N95s as such, but function closely like that. Is as long as you can get that tight fit, as long as what's behind the ear still causes it to be a tight fit on your face, then you'll be fine. And again, with that milk blown material, what you're doing is you're making sure that any air that comes through that mask is in fact filtered. And that's really key. And a lot of people don't understand that. They just think if I, have something I can breathe through, then that takes out the virus, and it doesn't at all.
And another question we have, how long do you use a mask before you change it, get rid of it? And how long does it take before the booster kicks in?
Yeah. Well, in terms of the mask itself, if it's not soiled and it's still intact, meaning the straps aren't broken, it's not frayed at the edges, you can wear them for quite some time. I wear my N95 sometimes for weeks without having to change them out because I'm not getting them soiled and, it's still intact. So and from that perspective, that's good news. You don't have to throw it away every time you use it. As far as the booster, I think you're referring to the vaccine booster.
Yeah.
In that case, actually, the booster actually takes effect fairly quickly. The data we have shows that within several days, you reconstitute that immune response like you had before with the previous dose of vaccine. And so from that standpoint, that's good news. The challenge is how long does it last? And I think that that's where, we have a concern, is because we're seeing now that 6 to 10 weeks out from that booster dose, you not only have waning immunity against being infected again, but we're starting to see, particularly in the older population, more risk again of being hospitalized and becoming seriously ill. So that's why I keep saying we can't boost our way out of this pandemic. We need new and better vaccines. These vaccines are remarkable what they've done. They've saved millions of lives, but we still need something even better.
Well, one question we often get is, why do some other countries do so much better than we do? And there was a recent major story in the newspapers on Australia, that Australia, which has similar demographics as the U.S. and gets a lot of foreign visitors, has 1/10 the number of fatalities adjusted for population, which translated to our country would mean that if we did what Australia did, we would have saved 900,000 lives out of the million we've lost so far. Why is Australia so successful?
Yeah, this is a really important question. And it's one that, I have been asked multiple times over the course of the pandemic. Well, if we just did it like Sweden, we just did it like Hong Kong, we just did it like Australia, we just did it like Japan, look how much better off we would be. And in every instance, if you look carefully at a country and what they did, it also depended on whether or not they got hit early in the pandemic, in the middle of it, kind of where we're at, or now, because the variants changed. So a variant wiping through a country right now is Omicron. In many instances, it'll be largely milder illness, less severe illness. And so they won't have the number of deaths. It also has to do with regard to how old their population is and what are the underlying risk factors for the population. They all are part of the complexion of, do you get infected or not? And if you do you get seriously ill? And I think that, take China, for example. China went for so long and did very, very well, in terms of very few cases, in terms of severe illness. There, everybody said, we'll do it like China. Well, they did keep out the variants of these other ones of concern, by their rather draconian measures. But by the time they got to Omicron, which was so highly infectious, at that point, they couldn't control it. It was like trying to control the wind. And so now China and Hong Kong, both areas that had previously done so well, are not doing well at all. So I just point that out to you because Australia, when they finally did get hit, and having kept out the virus with travel restrictions that first year, got hit by what I would call the less likely to cause severe illness variant. So that's part of it. Part of it was also the trust, and you've heard about that. The Aussies were more willing to abide by restrictions, distancing. They did a much better job of basically controlling transmission in their communities, and it paid off. The challenge is they became more like the rest of the world the last 6 months, and there have been major protests filed, people who have violated what was the Aussies' recommendations for distancing and so forth, lockdowns. And today they're kind of in the same boat we are. So I think one of the lessons learned here is that, yes, you can do something about this virus, but it depends on which one you get hit with, and it depends on how long it is that what you're doing happens. And at 2 years out, people's fatigue just gets to be there. Ironically, we saw the same thing in 1918. If you look at 1918, you can see that in those years of 1918 and 19, with the big peaks in cases that occurred, the public was largely compliant with public health recommendations on distancing, shutting down parades, things like that. By 1920, when we still had a couple of big spikes, the country said, done, we're done. We're not going to do this anymore. And they went ahead and did it, which is almost the same time period we saw in the United States where the public just said, we're done.
Well, the article that explored the Australian experience appeared in the New York Times on May 15th. For listeners who want to go into detail. Apparently, they have 95% of their adults fully vaccinated, which is far greater than in the U.S. What kind of credence do you give to researchers who are saying we need a nasal vaccine to catch the virus before it gets into the lungs?
And let me come back, Rolf, because I think you raised a very important point on the high level of vaccination. That, again, is that trust that I talked about, where when the government laid out the vaccine program, they laid out the benefits, they laid out, what challenges we have. The public believed their leaders. In this country, if you're in public health today, you could tell the world that the sun's going to rise in the east and set in the west, and half the public wouldn't believe you. It's a real challenge. And so that, I can't emphasize enough how critical the point you're raising here actually is and what that means.
By the way, Michael, the New York Times makes a big deal of the trust. They quote Australians saying, quote, I just hate to be the one who lets everyone down.
Exactly. Yeah, I think that's such an important point. And so I want to come back to that very point. So, and your other question was, again, I apologize.
On the nasal vaccine.
Oh, yeah, nasal.
Yes.
Yeah, this is where we have to look at these kinds of vaccines, but I'm a little concerned about that. And the reason I say that is because mucosal immunity, meaning if I can get the area where the virus may first enter in my nose, my upper respiratory tract, and I can get a localized response immunity-wise. So the virus basically gets hit right away. It doesn't even have to go into the lungs before you try to fight it off. But the challenge with that is we've seen with influenza virus vaccines, where we've also had a respiratory transmitted virus like COVID, as well as the fact of vaccine that has been used in the nasal area, flu mist, which has been commonly used often in children. And guess what? It works really pretty darn well in children. Why? Because they've not previously been infected by influenza viruses. But once they have an infection, they develop some localized immunity. Not necessarily all that effective, but they develop some. And now if I vaccinate them, the vaccine impact is minimized by this localized response. So meaning if you can get respiratory nasal vaccines in before you ever experience anything else, you might have a chance. But if I've already had it, or at this point, I may not get a good take. And so we have to look carefully at this. It makes good sense intuitively. If we could get a mucosal response, that would be great. I'm not sure we can get that with this virus yet, based on previous experience. And so that's one of the things we're looking at.
The nasal vaccine advocates are so focused on the nose. Does that mean that you don't get exposed too much with the virus into your mouth and down your throat?
Yeah, you don't. Really, it's the upper respiratory. It's in that area of the nose and down into the top part of your throat that really is very important in the first seeding of the virus. And then, of course, from there it moves. But I want to be certain to say we have to explore these nasal vaccines, very much so. But I think based on the flu experience, we want to be very careful about just assuming that they'll automatically work. So yes, we need to explore them, but I'm not as optimistic that'll happen just based on our own experience with what we saw with influenza.
Well, let's look at the interconnection between zoonotic transmission from animals, which Ebola signified, and others in Africa and elsewhere. Do you see habitat change, global warming, increasing the likelihood of animal transmission? And by the way, do you think the mink situation and the deer can generate mutations that are much more real and transmissible to humans?
The answer to the second question is yes. That's a concern people don't want to hear. The answer to your first question is an emphatic yes. I think that the world right now that we live in is basically taking over every nook and cranny of space out there, including all these different animal species and their habitats. And for example, bats. Most people don't realize that bats actually have a longevity of life same as or older than humans themselves. 18 of the 19 mammal species that have life expectancies comparable to humans are bats. Well, bats have been for a long time the primary reservoir for a whole series of viruses based on their immune system. They don't die from rabies necessarily. They don't die from a lot of these infections. They can stay infected chronically. And you know what? We are now invading, in a sense, as humans, every space that bats have lived in for many, 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 many eons. And so right there, the spillover potential for a bat to a human is huge. But if you look at all these other animal species, it's the same thing. And don't forget, Ralph, as you and I have talked in the past, today trying to feed 8 billion people means that we need a lot of protein. And so now we're seeing bushmeat, a lot of the kind of exposure to wild animals for the very purposes of just finding food. Well, when you have an animal like that you're encountering, you're butchering it, you're cleaning it, blood, body fluid contacts. It's just not just you're in the same space with it. And so I think that we're only going to see more and more spillover events. And then we're going to see old viruses coming back. I mean, monkeypox. Here's a virus that was largely brought under control over centuries and centuries, because if you had immunity to smallpox, you were immune to monkeypox. When we stopped vaccinating the world, 40 years ago, we've now created an entire generation of people who have no immunity to monkeypox. Well, that's still in the wildlife reservoir of Africa. And now suddenly what's happening? We're seeing it spill over into people. So I think all of these just lend themselves to the fact that we're going to see more and more of these infectious diseases emerge, and we have to be prepared for them. And as you know so well, we have real challenges that way yet.
Don't we need really expanded budgets, expanded training for more specialists, more on-the-ground application people to put knowledge to work in communities and clinics? I remember, Michael, when I was at Princeton, a lot of the graduates with me went to medical school, and after they were out of medical school, we'd get talking. And the professors said, don't specialize in infectious disease because antibiotics are going to take care of it all. And so we had a real paucity over the decades of infectious disease specialists. And I know you've written and warned about antibiotic resistance, which is killing people every day in this country because the mutations are overcoming existing antibiotics. Can you tell us what your urgent recommendations would be in terms of budget, specialists, and self-sufficiency here in the United States?
Well, thank you for that opening. As you noted, and as the introduction of the program, in 2017, Mark Olshaker and I wrote a book called Deadliest Enemies, Our War Against Killer Germs, in which we talked about exactly this very issue. We raised very clearly the challenges with pandemic preparedness or lack thereof, antibiotic resistance, etc. Well, we're now writing the new edition, which will take lessons learned from the pandemic. And I must say that it is daunting. I mean, Ralph, think about this. Here we are after having just spent all the money we did, how much this pandemic has cost us in human lives and dollars and disruption to our society. And we have a modest request of $20 billion into Congress for more vaccines and drugs, which we're going to need and can't get it filled. I mean, what lessons have we learned or not learned? It's like almost we're back to ordering the fire truck from the local manufacturing company when the 9/11 call comes in. And so I do worry that we're not learning the lessons we should be learning here. And one of the things Mark and I will be doing is actually, highlighting these very issues and where can we make investments? What kinds of things can we do with vaccines and drugs that can have them on the shelf ready to go? I mean, the example I just gave earlier, the monkeypox situation, fortunately, we actually had done the work 25 years ago to get new and better vaccines against the orthopox virus, the smallpox, monkeypox, etc. And today we're in much better shape. That's what we want to have preparedness for. We, at this point, don't have that mindset, and we really desperately need that.
Well, it all comes down to Congress, of course. That's the lever that the people have to turn priorities around. One thing you've succeeded in doing, Michael, is you have reached the mass media. You've been on Meet the Press and the national networks. How do you evaluate, especially in the last few months of subvariants and fatigue, the mass media? Is it slowing down its coverage of credible information?
It doesn't do much to get deep into a topic area, meaning it's sound bites and largely to the extent that it's the news of the day. For example, no one's really looked at where is this pandemic going? What might be the possible outcomes in the course of the next 6 to 10, 12 months? And, also the other thing that I find very challenging is that anybody can be a talking head today. I consider myself one of them. So from a pejorative standpoint, I'm talking about myself. But, no one really does any kind of effort to go back and look at the talking heads and say, no, wait a minute, this is what you said 6 months ago. This is what you said a year ago. Well, did it happen? What's right about it? What's wrong about it? A broken clock is right twice a day. Were you better than that? And I think that the fact of the matter is a lot of the public statements that have been made, a lot of the purported findings or projections are bogus. They're based on pixie dust. And I wish they were doing a much better job of actually holding all of us accountable for what we say, how we say it, when we say it. And they just don't.
I'm looking for more urgency from the American Public Health Association, American Medical Association, the various other associations, the medical schools, really getting together and focusing on Congress. I mean, you turn around a majority of those members of Congress, you turn around public budgets, you turn around much more skilled specialists, you turn around bringing back pharmaceuticals here to the U.S., you turn around a lot of things to head off what's coming from around the world in terms of future pandemics. So I hope we can work together on this.
I welcome the chance, Ralph. Anytime, you know that, okay?
I certainly do, and we applaud your efforts. Well, we've been talking with Professor Michael Osterholm, the University of Minnesota infectious disease expert. Thank you once again, Professor Michael Osterholm.
Thank you very much, Ralph. It's always an honor to be with you and the team here, and I look forward to the future.
We've been speaking with Dr. Michael Osterholm. We will link to his work at ralphnaderradiohour.com. Up next, let's hear how college students are fighting for the future that their generation deserves. But first, let's check in with our corporate crime reporter, Russell Mokhiber.
From the National Press Building in Washington, D.C., this is your Corporate Crime Reporter Morning Minute for Friday, May 27, 2022. I'm Russell Mokhiber. Wells Fargo advisors will pay $7 million to settle charges brought by the Securities and Exchange Commission for failing to file at least 34 suspicious activity reports in a timely manner between April 2017 and October 2021. The SEC alleged that due to Wells Fargo's deficient implementation and failure to test a new version of its internal anti-money laundering transaction monitoring and alert system adopted in 2019, the system failed to reconcile the different country codes used to monitor foreign wire transfers. As a result, Wells Fargo did not timely file at least 25 SARs related to suspicious transactions in its customer brokerage accounts. For the Corporate Crime Reporter, I'm Russell Mokhiber.
Thank you, Russell. Welcome back to the Ralph Nader Radio Hour. I'm Steve Scrovan, along with David Feldman and Ralph. The acronym PIRG, P-I-R-G, stands for Public Interest Research Group, an idea conceived by Ralph in the early 70s to nurture student activists. The idea was originally propagated across campuses by the late, great Donald K. Ross and has been carried on by subsequent generations, led by people such as our next guest. David?
Dan Xie is the political director at Student PIRGs, where she directs the national political strategy, advises staff and students on strategic campaign plans, and amplifies their work with coalition partners and at conferences. Dawn has managed successful campaigns to cap global warming pollution, fight the high cost of higher education, and make voting more accessible for students. Welcome to the Ralph Nader Radio Hour, Dan Xie.
So good to be here.
Welcome, Don. Well, because I had an important role in starting the PERGs, I have to make an admission here that I think the PERG movement is the most consequential and result-oriented student movement in modern American history. It goes on year after year since the first PERGs were started in Oregon, Minnesota, later spread to almost 24 states. They're full-time, student-run, nonprofit citizen advocacy groups. So the 18, 19, 20, 21, 22-year-old students on the board retain a professional staff, often of organizers, writers, advocates, lobbyists, connectors to advance environmental health and equity for students in a variety of ways. They've also improved prison conditions in some states, mass transit in New York City through a group called Strap Hangers Group, and many other impacts. Sometimes the students have been given course credit for this. So now we are 2022. The Student Public Interest Research Groups, or PIRGs as they're called, are still active and running, which points out the importance of establishing institutions that endure. They're funded by student checkoffs or student government funding. They also have canvassers. Some student PIRGs canvass hundreds of thousands of homes a year on things like water pollution or other state and local initiatives. So having said that, Dawn, you're the political director, and I want you to tell our audience, because they're not reading about these PIRGs in the mainstream media, because the PIRGs don't engage in disruptive or outrageous behavior. They just get things done using reason, evidence, truth, justice. How are you getting out the vote? Let's start with the student vote. That's one of your projects.
Yeah, absolutely. And I won't disagree with you on the efficacy of the PIRGs and the student movement. I certainly came from that history. I was on the student board for 3 years as a student and really didn't recognize the power of young people and how unstrategic we could be until I got involved with the movement. So thanks for that background. And you're right, voter registration outreach is one of our biggest campaigns right now. We think, of all the issues that young people care about, if you can increase youth voter turnout and engagement, that will result in more elected officials paying attention to the youth voice. And you can see that over the years. In 2004, when I started college, not a single national elected official was leading on the cost of higher education or the massive amounts of student debt that have accumulated over the years. Now, basically every major candidate talks about it because the youth vote has been such an important block. And we want to maintain the power of young people in politics. And I'll say our work is grounded in doing peer-to-peer work on campus, engaging folks in their dorm rooms, engaging them at their dining halls, making sure their professors and their leaders on campus are talking about voter registration engagement. And there's a lot of movement these days to buy big lists, to text strangers. That's not the PIRG model. We go on their campuses, we knock on their doors, we get, their leaders, the college Democrats and the Republicans to come out and say, this is why it's important for you to vote. And it works. Coming out of 2020, of the students that PIRG registered, 82% of them turned out to vote. And if we called a student and reminded them to vote, it's astronomical. And that's higher than the average rate overall.
Which is far higher than the 30% nationwide for young people turning out to vote. Speaking of campuses, you teach students how to practice what they preach or preach what they practice through a project called 100% Renewable Campuses. Can you discuss that?
Yeah, absolutely. This campaign is the number one campaign of the generation. Climate change is, for this generation, it's the last generation that will be able to do something about the issue and, one of the first to feel the impacts. And so we've been, over the last decade, worked to put renewable energy and solutions up front. And so we started this campaign about 5 years ago to get campuses, cities, and states to commit to 100% renewable energy. And today, 1 in 3 Americans lives in a community that's committed to 100% renewables. And we ended the semester with another huge victory, University of Massachusetts Amherst committing to 100% by 2032, which is one of the fastest timelines out there. Which isn't to say there aren't setbacks. Our Florida students worked to, overturn a really terrible solar bill and successfully worked with the coalition to get Governor Ron DeSantis to veto the bad bill. So there are steps backwards for sure, but students are certainly leading the movement for solutions as well.
Before we continue, we're talking with Dan Xie, who's the political director of the PIRGs. Give our audience your website so they can write it down, because we're not going to be able to scratch the surface of what all the PIRGs have done from coast to coast and from Washington State to Florida and from Massachusetts to California. What is the website?
Yeah, Student PIRGs.org, studentpirgs.org. And you're right. I think last year our students ran 144 campaigns. Students pick all the issues that they work on the ground, which means I know a little bit about a lot of issues.
And you're on 100 campuses in 25 states providing civic training, because the curriculum of colleges don't really provide civic training, professional support and resources students need to tackle climate change. I wish you would call it climate chaos or catastrophe, to tackle climate change, protect public health, revitalize our democracy, feed the hungry, and more. And so this is an excellent opportunity for students not just to get educated in the formal curriculum, but put knowledge to action on the ground in their communities. How are you expanding? Because I know you take on a lot of corporate power abuses, and the corporate indentured boards of trustees of universities and colleges have often tried to block the PIRGs and suspend the funding. How are you managing your expansion program to include more campuses?
Well, first, if you're listening out there, you can definitely give us money. We love money. We are asking more of our alumni, more community members, professors, folks who support the work to contribute. And that gives us great flexibility to really respond to student community needs. Whatever issues are impacting them that they want to work on, we're able to then, deploy a new campaign whenever a new need arises. But honestly, the student fee system, you're right, it's very difficult in the modern bureaucracy of the university. And so a lot of our expansion is now through grant and foundation money and through individual contributions. But in the last year, it's really worked. We were able to triple our campuses coming out of the 2020 elections, which is incredible, and continue to offer these services to even more students across the country. So here in Florida, where I live, we had one campus in 2018, and now we have students at 8. So that financial support has allowed us to hire more staff, basically.
And are you getting more recognition by faculty and boards of trustees that this is a wonderful effort without costing the taxpayer anything to expand the educational civic skills and knowledge of students? I mean, they ought to be praising you and supporting you. And in a lot of these states, many of them in the South that don't have a single PIRG.
We have a lot of support on campuses when we arrive, because I think you're right. Most curriculums don't incorporate how a young person can actually be effective in democracy. And I'll say, I went to school in California. I studied political science and environmental policy. I learned a lot about the problems in my classes, and I didn't learn a single thing about how to get my elected officials to do what I wanted them to do. In classes, you're taught that an issue is not politically feasible, but not explained how to make a thing politically feasible. And so our students across the country are working with supportive faculty and administrators to get course credit. So I actually got 9 units for PIRG my senior year, which helped me graduate. And, that allows students to take what they're learning in the classroom and actually apply it on the ground. And I think it's very rare to then see results within a semester, a quarter, or a year or two. So, I helped pass a statewide bill to cap greenhouse gas emissions within a year of being involved with PIRG as a 19-year-old. Most young people don't have that experience. And that's why I've, been with the organization for 15 years, because I think more young people should have that experience.
Well, in New York, PIRG, which was built by the late, great Donald K. Ross, he would have once a year in Albany almost like a civic skill jamboree, where students would come from campuses all over New York State, and they'd learn rigorously civic skills, which are not taught, as I said, in most curriculums. Are you still continuing that tradition around the country?
I got to take that to our boards. Civic skill jamborees. They're called much more boring names now, like the New Jersey Grassroots Organizing Summit.
Yeah.
But I think the principle is the same. We do bring students together in states and regions, and then we host a national student forum every year as well, so that they can share and germinate new ideas and skills. But yeah, you're right. We got to bring in some more fun to the names of our conferences. I love that.
Well, tell us about your Open Textbooks Alliance.
Yeah. So the hidden cost of college, we found, is the cost of textbooks. So we've done studies for now 21 years on the impact of the cost of textbooks and course materials. In a 4-year university, textbooks can be up to 20% of the cost of higher education. And in community colleges, it can be up to 40% of your cost of higher education.
How is that possible when these textbooks are produced in great volume? And, I can get a dictionary now, a hardback dictionary for $11. Why are they pricing these publishers, who are often been accused by the Justice Department of antitrust collusion? Why are they charging, what, 50, 80, 100? Some law school textbooks are $200.
$250, Ralph, $250 for a calculus book. Calculus hasn't changed for centuries. I don't know. They come up with new editions. And we actually did a study. We read the new editions and went, what is different? And we came out of that study and went basically nothing. They rearranged the chapters. They'll add discussion questions at the end and make it impossible for a professor to reuse the book.
How are you going to go after them? I just had someone recently tell me that in community colleges, the cost of the textbooks are greater than the cost of the tuition. How are you going after these collusive publishers who are gouging students?
Yeah. Open textbooks are the solution, the long-term solution. So folks may be familiar with open source code, for example. It's basically information that is out there that you can remix, rewrite, and use to, the best of your ability to maximize what you want to do. So if you're doing code, that means you can build on that code and create a new program. For a textbook, it means that you're a professor, you can actually regionalize and localize the content that you're training your students on. And these are free textbooks written by professors. They are peer reviewed, and you can download them for free and use them for free if you're a student, or print them out for $10, $20, which is far cheaper than a publisher textbook.
Is it working for a lot of students?
It is. 10 years ago, 1% of faculty had ever heard of an open textbook. Now 9% of all faculty have heard of open textbooks. And we actually have, in this last appropriations budget, so in this last national budget, there's $12 million allocated in support of developing and incorporating more open textbooks into classrooms. And that's the 4th year of this open textbooks pilot program that we advocated for overall.
Well, you also have a project called Students Against Hunger. What's that about?
The average college student is not who I think you would stereotype as a college student in movies, right? Someone right out of college who is supported by their parents. College students, the face of college students is very different these days. In our surveys, 40% of college students have experienced food insecurity within the last month. All the while, college campuses on average throw out more than 100 pounds of food per student through waste because of dining halls and other food services. So our Zero Waste, Zero Hunger campaign is working to address food waste and get it to the people who actually need it. And we also have been working with allies to pass bills called the Campus Hunger Bills that would basically provide more resources to campuses to provide food banks, emergency housing, and resources for students to apply for SNAP or statewide programs to help alleviate hunger. The first bill passed in California, and it actually made it out of committee in Florida with bipartisan unanimous support this year as well.
And what about your Homelessness Awareness Week?
We have been hosting our National Hunger and Homelessness Awareness Week for decades now. This is a great campaign because it allows students and community members to work together to address the issues of hunger and homelessness in their communities. Every year, hundreds of groups in hundreds of locations across the country host service events, fundraisers, educational events, and advocacy events to not only directly help people who need it in November right before the holidays, but also advocate for longer term solutions that help those in need.
Now, people should know that these student PIRGs are nonprofit institutions. They're independent of the university or college where the students connect. But some faculty are so laudatory that they actually give course credit to some student projects. I know a student years ago from SUNY Binghamton did a project on hearing aid reform, getting deceptive practices removed that have been imposed on elderly people. She actually got a bill through the legislature in Albany and got course credit for it. Is this still going on, course credit?
Absolutely. Yeah. You would think it's only for political science or environmental policy folks, but it's actually quite an expansive internship program. I worked with a student who's learning mass media And her internship was making a video about the local homeless problem and showing that film during Hunger and Homelessness Awareness Week. We've had folks who work in engineering help on campaigns. We've had folks who do comms, folks who do art. So we've had a lot of trash art shows. So it's really quite expansive. And I think students from any background and any major have an opportunity to take their skills and get involved with our program to make the world a better place.
Well, unfortunately, we're out of time. We've been talking with Dan Xie, Political Director of Public Interest Research Groups that are in some 25 states and 100 campuses. And why don't you, before we conclude, Dawn, give again slowly the website.
Folks can find us at studentpirgs.org, studentpirgs.org. If you're a student or you know students, they can apply for an internship program there. And if you're a person who wants to contribute to our movement, you can certainly do that on our website as well.
And there is a U.S. PERG in Washington that is supported by the various state PERGs. Is that got a website?
Yes. If you are not a student and you want to engage in public interest work, you can go to uspirg.org, uspirg.org.
And for listeners who want to know more about the history of the PERG movement, the early books on it, 2 editions titled Action for a Change that I had a part in, and you'll see what the inspiration was and what made it continue decade after decade, something that doesn't occur much in U.S. civic history. Thank you very much, Dan Xie. To be continued.
Thank you. Thank you, team, and thank you, Ralph. Those are still books that we have our staff and students read, so they continue to be important and influential in the movement.
We've been speaking with Dan Xie. We'll link to her work at ralphnaderradiohour.com. That's our show. I want to thank our guests again, Dr. Michael Osterholm and Dan Xie. For those of you listening on the radio, we're going to cut out now. For you podcast listeners, stay tuned for some bonus material we call the wrap-up. A transcript of the show will appear on the Ralph Nader Radio Hour website soon after the episode is posted. The American Museum of Tort Law has gone virtual. Go to tortmuseum.org to explore the exhibits, take a virtual tour, and learn about iconic tort cases from history. And be sure to check out their online gift shop. You'll find books, posters, and flaming Pinto magnets and mugs for all the tort fans in your life. That's at store.tortmuseum.org.
To order your copy of the Capitol Hill Citizen, the pilot issue is only $5. That's to cover shipping. Go to capitolhillcitizen.com. Join us next week on the Ralph Nader Radio Hour, where we welcome Bill McKibben. Thank you, Ralph.
Thank you, everybody. Take heed from this advice. It's really very, very important.
Hi, this is Jimmy Leeward, producer of the Ralph Nader Radio Hour, and welcome to the wrap-up, where we continue our conversations with both Dr. Michael Osterholm and Student PIRG Director Dan Xie. First, Dr. Osterholm and Ralph talk about the possible origins of the COVID-19 virus.
On the question of origins here, there's a bill in Congress to establish a commission to investigate where this virus came from, how it was transmitted early on. The WHO sent a team over a year ago, as you well know, to the Wuhan Institute, and they didn't get the access to the data. The Chinese government was relatively hostile and continued its secrecy. What's your view now? There have been scientists saying it is entirely possible that it could have been genetically engineered leak from the Wuhan Institute. They didn't say it is because they don't have the evidence, but they raised the questions. What's your view on this? Will we ever know?
Well, first of all, let me just say that this has been an area of concern for me for many, many years. I was on the National Science Advisory Board in Biosecurity, the federal oversight committee, looking at research that may be dangerous, meaning research we want to do, but if the virus is changed intentionally to look at transmission characteristics and it leaks out, wow, what would happen? So I've had a record of being very concerned about laboratory-based manipulation of viruses or whatever, could they leak out? So I come at it actually from that perspective. At this point, I think it's fair to say we are not going to likely ever know what happened with this virus relative to what happened at Wuhan. And, no matter how much we want the Chinese to provide more information, what they can provide, I don't think that's forthcoming. And I would add that I can understand that to the extent that I'm not saying I support it at all, but imagine if a virus developed in the Caribbean that was of some real novel existence and causing bad illness. Where might we pick it up first? We might pick it up in Atlanta. And the reason for that is people fly in and out of Atlanta all the time to get to the Caribbean. Well, if that happened in Atlanta, I could guarantee you that everyone who has these same conspiracy theories would say, this leaked out of the CDC lab, okay? And therefore, we as Chinese and Russians want immediate access to the CDC lab. We're coming in. We're going to have unfettered access to your lab. Do you think we would do that? No. Do you think it would mean that the lab and CDC was responsible for it? No. And so I'm merely just looking at the Chinese point of view saying, we're not going to let the US and Russia and everybody else just have access to our labs. Right, wrong, or indifferent, however you want to look at it, I think that's the case. But I would add one more point. And the point is, again, I'm agnostic and open to whatever data comes forward. But when you look at this virus and you look at how many animal species is now infected, as well as humans, and you look how it's changed just being in humans, meaning that the changes between those ancestral strains in Wuhan versus whatever could have been in a bat in a cave is so limited compared to how much has changed since it's been in people and where we're at now, going from the ancestral strain to the alpha variant, to the beta, to the gamma, delta, all these different things. I think that there is surely a very clear picture that this emerged in wildlife, came into humans, very inefficient initially in humans, and got a hell of a lot better over time as it went through more and more humans. Basically living in a world where more people became immunologically positive, immune, because they previously had it, gave the virus even more evolutionary benefit to say the ones that are going to survive are the ones that can get through this immunity. So I don't see any data at all, any smoking gun that supports that this came out of the Chinese lab. Again, I'm more than willing to consider such information. I just don't think it's going to be forthcoming. And I can tell you what it's done since it's been in humans. It's just simply remarkable genetically what that's done. And now, as you know, it's in white-tailed deer. We see it in mink. We see it in a number of different animal species. And I worry that the kinds of genetic changes that will occur in that setting are only going to make this virus more challenging in the future.
Let's talk about U.S. funding through the National Institutes of Health, gain and function research, including to the Wuhan Institute. That's gain and function where you, for scientific purposes, you work the genetic material to make the virus more violent or more virulent. That Department of Defense did that before Nixon stopped biological warfare research. This seems to be something that needs to be subject to an international treaty. And there are a lot of issues that need to be subject to an international health treaty. I understand we don't produce antibiotics anymore in the U.S. We import them from China or India. We import a large amount of the active materials in our pharmaceuticals from China and India. The FDA has very few inspectors in China and India inspecting these labs. There have been some bad situations reported. Put your policy-making hat on now. What would you do on gain and function research, knowing that the safeguards in labs around the world may not be up to par? And the second, what about being more self-sufficient in terms of our own medicines, including antibiotics?
Yeah. Well, you've raised a good number of topics here that are basically worth a couple of shows. So let me see what I can do, okay? In terms of the issue with gain of function, it's a real concern. I'm very concerned. I used to be concerned primarily about several government labs in various parts of the world that could do this. But what we've seen happen is, I call it the iPhone phenomena. Here we were in 2006, we didn't have iPhones in this world. That was 5 years after 9/11. And look where we're at today with iPhones and modern cell technology, applications, et cetera, et cetera. What's happened, Ralph, is that so many labs in the world can now do this kind of gain of function work with just the readily available new modern tools of laboratory science. Keeping track of that and who does it and how they do it is really incredibly challenging. It's no longer just focusing on the Russian program or the North Korean program or any of things like that. It's some buddy who has a mental instability situation out there. I mean, Ted Kaczynski was very seriously mentally ill, but he created a hell of a bomb. Today we have the same thing where we have any number of scientists around the world who may have mental health issues that could do the same kind of thing. So it's taken on, I think, even a more significant issue with us right now is how would we even know? How do we monitor? How would we find out if somebody's trying to cook something up in their basement that they might be able to do today that no one would even imagine they could have done 20 years ago? That's a challenge. I don't have an answer for that, but it's one that, we need to be constantly mindful of if people are ordering certain kinds of supplies or that people are, trying to learn how to not land a plane, but just take a plane off. That should be a warning sign to us if somebody's trying to do something in a microbiology laboratory in an academic setting and all they want to know is how to grow something like this. That should be a real warning shot. So I think this is a huge issue and it's going to be a challenge going forward. And I don't know at this point just where we're at in terms of what we can do globally on that issue.
I once spoke to a national convention of psychologists and I said, you're not expansive enough. You talk about individual mental health. You should talk about institutional mental health or institutional insanity and the allocation of budgets where $1 trillion goes to military budget, empire, waste, corruption, contracting with the Lockheed Martins, F-35s, et cetera, is at the expense of protecting the American people here at home. I saw one reference, 100,000 people a year die because of antibiotic resistance in this country.
That's true.
That's 2,000 a week. And the annual budget for the U.S. Embassy in Baghdad is $500 million, which is the equivalent of the OSHA budget to protect against occupational diseases in the workplace and traumas. So do you see your credibility of your profession academically, operationally, able to organize more of a laser focus with your urgent concerns on senators and representatives, which will then activate a lot of citizen groups to get Congress turned around? This is not something that is pie in the sky because the members are scared of their own skin because this is contagious disease.
Well, let me just summarize it by saying, Ralph, you have been a role model for me for decades, ever since I worked for Mark Green way back in the 1970s in your organization. And I've never watched you slow down for a moment, despite the fact that you have a couple of years on me, okay? Well, I plan on trying to do the same thing, okay? I can't help myself. I'm like you, okay? So I am committed to and will continue to do whatever I can to change this world around. And I actually have one motivating factor that to me is absolutely clear and compelling. I've got 5 grandkids. And, if I do nothing else in this world, I want to try to leave the world in a better place for those 5 grandkids. So you know what? I will lobby. I will speak out. I will be willing to take, if it's a 26-hour day, whatever it takes to get there. But all the points you just raised are exactly right on the mark. And I will continue to do my best to keep it going.
Because we were out of time with Professor Osterholm, I didn't get a chance to get his reaction to John Nichols' book, Coronavirus Criminals and Pandemic Profiteers, and Holding Them Accountable. But that's part of the problem, too, in treating this pandemic in a rational, efficient, and honest way. The corporate criminals who are profiteering are allowing this pandemic to claim more victims. And the government regulators who are looking the other way are aiding and abetting this kind of grossly unpatriotic and criminal behavior. For more details, just go to John Nichols' book, Coronavirus Criminals. Very well documented.
Right. And you could also go to the Ralph Nader Radio Hour from a couple of months ago, and when we spoke to John Nichols about his book, and he outlined it there for us there too.
And now we have an extended conversation with Student PIRG Director Dan Xie.
Well, for over 40 years, Don, we're talking with Dan Xie, the political director of the PERGs. I've been trying to get the New York Times to write a feature on NYPIRG and its enormous successes throughout the state of New York. They wouldn't do it. They wrote features on right-wing bigots, big features with pictures. They write features on compromised think tanks that are funded furtively by corporations to try to advance anti-labor, consumer, and environmental policies. And it's also true of the Washington Post. They haven't done anything on PERG. I mean, what's going on here? It's almost a pathological indifference because they know their readers would really be interested in what students are doing that is so constructive, so progressive, training for future participation in the democratic society, striving for justice. What's your explanation here? I don't see any of the big national television programs doing anything. I haven't heard NPR or PBS doing anything. Am I missing something here, Dawn?
I would love a feature on any of those outlets of the power of the student movement through the PERGs over the last 50 years. I'll tell you, I go to a lot of conferences to represent the students on all kinds of different issues, ranging from the high cost of higher education to civic engagement to climate. And at every one of these conferences, I meet a ton of PERG alums who got their start doing an internship or volunteering with us on campus, or their first job out of college was working as a campus organizer, or they canvassed one summer when they were a student knocking on doors in the community on an issue. So I think our impact has been deep, but overall the stories we want to tell are the stories of young people taking action. And I do think those stories are out there on all of those outlets, reporting on, our students taking action overall. But, it may have something to do with the brand, Ralph. PERG as a name, it's tough.
Well, it was named that way during the Nixon administration, which was going after progressive groups. So we thought if you just called it a public interest research group, they wouldn't have anything to hang on to verbally. That was the source of it.
Very smart.
There is one exception. By the way, Dawn, there is one exception. The media has given considerable press and television to your right to repair endeavor, which is starting to succeed. So people can repair their electronic products and so on, not have groups like Apple and others design it so you have to buy a new Apple product or you have to have it repaired expensively by an Apple outlet. Isn't that correct? Didn't you get good coverage on that?
Absolutely. And I love that campaign because it really crosses all of the partisanship barriers that so often exist in today's politics. We've got farmers who can't repair their tractors on board with this campaign. We've got millennials who are mad about their iPhones. We've got folks who can't repair their wheelchairs because the wheelchair companies are holding them hostage. And so this is an issue that I think really impacts everyone. And I think that's one of the reasons why it's garnered so much support, because we all expect to be able to take our car into an auto body shop, even if it isn't the dealer, and get it repaired. Why can't we have that same ethic for every other thing that we own?
Well, let's turn to an area which I think the PERGs should start paying attention to. Nixon abolished the draft, and the moment he abolished the draft, the anti-war fervor on campuses began to diminish on the Vietnam War. But the military budget is devouring our country, and it's devouring the necessities that need to be treated by adequate public budgets, like public health, like environment, like education, and so many other areas are neglected because the U.S. has an empire with bases in 100 countries spending untold money. Over half of the U.S. government's discretionary budget is the military budget, over $1 trillion now a year, not counting all the horrible expenses to returning veterans suffering from diseases and traumas. Is there any discussion in PERG circles to connect with groups like Veterans for Peace and really take on the military budget?
That hasn't been an issue that's been on the top of the minds of our students, but certainly something to consider.
Yeah, because someday we may get into real imbroglios abroad with opponents that have modern weapons, not just rifles and IEDs, and the draft may be reinstated. But peace has got to be a major factor in any student movement. They led in the Vietnam War's fights. They led in opposing the Vietnam War valiantly with massive student gatherings on campus, student rallies, students educating their parents. returning students from Vietnam who were drafted. So I hope you can take that up. Say the website one more time, then we're going to bring in Steve and David.
All right. StudentPIRGs.org. StudentPIRGs.org.
And Dawn, is there a special website for your Open Textbooks Alliance project?
There is, and you can just scroll to the bottom of that link that I just said, and you can link to both our National Student Campaign Against Hunger and Homelessness website and our Open Textbooks Alliance website.
Okay, that's good. Well, Steve, David, pitch in here.
Yeah, Dawn, we were speaking just before we went on the air, and I had asked you how you got into this work, and you told an interesting story about that and why you didn't go to law school. Could you tell that to our audience?
Yeah, absolutely. So, I come from a pretty stereotypical Asian immigrant background. My parents really wanted me to go to law or medicine or engineering. Business wasn't okay for us. That was allowed. And so when I got into college, I really was concerned about climate change and the destruction of our environment. So I thought, man, environmental law, that's a really good compromise for my parents and the thing that I really want to do. And I knew I needed to get an internship to get into law school. Someone came into my class my sophomore year and said, hey, we're a bunch of college students. We're going to get Governor Schwarzenegger to sign a bill to cap global warming pollution. It was 2005, actually, when I got involved. And no state in the country had capped global warming pollution. And I was like, excuse my French, but I was like, bullshit. I don't think you're going to do that, but I need an internship. So I filled out that card and I got involved. And within a year, we had convinced our local elected official to support the bill, and the governor signed it. When I met him at the signing ceremony and came out of it going, why do I need to go to law school? Seems like if I just keep doing this, I can make a difference.
And what did someone tell you about going to law school?
One of the things I did to figure out what I was going to do with my life is talk to lawyers. And one of our staff at the time, our PERG staff, was trained to be a lawyer, but for some reason working for us for way less money. And I asked him, why was he doing that? And he said, look, if you think the laws that we have are good and you want to enforce them, go to law school. If you think the laws need to be changed and reformed, you should become an organizer. That sent me into a bit of an existential tizzy, but it's okay. Here I am.
And Ralph, I'm not discouraging people to go to law school because I know you're a big proponent of that, but I just thought that was an interesting perspective.
Yeah, very much so. David?
Right. Thank you, Ralph. One of the lessons that Ralph taught baby boomers, I think, is protesting is important, but eventually you need to get off the streets and get into the halls of government. And in the past year, I've been listening to the Parkland students on gun violence, the Sunrise Movement on violence to the planet. There's this 19-year-old Joe Thompson organizing Starbucks successfully in Santa Cruz. I'm listening to you. And America is churning out a generation of the brightest, most articulate and civic-minded young adults I've ever seen in my life. Apparently, our school system is doing something right. So what did you learn specifically in elementary school, What values were drummed into you in elementary school that you're drawing upon right now? And why do you think the conservatives are so terrified of our school system? What are they teaching you? Because they're teaching something.
I was thinking back on elementary school recently because we partnered with the Captain Planet Foundation on Earth Week a couple of years in a row. Do y'all remember Captain Planet, that show?
We're a little older. Hannah might.
If you look back on some of those episodes, it's basically young people taking on corporate polluters. That's the entire show. And that's what we grew up watching. And that curriculum was integrated into our elementary school and middle schools. I remember doing a project on endangered species and how conservation was part of our responsibility as a generation. I'll be honest, a lot of the reason I got here is seeing my parents come to America, chasing the American dream and financial stability, which took us many years to get to. And when they got there, them realizing that the consumerism and the brand names and the stuff were not satisfying. And watching them go through that process and watching my dad discover photography and us changing our summer vacations and winter vacations to going to national parks and seeing them experience that and have joy and wonder around it and finding that different purpose in life really propelled me to think about what is the purpose of us all being here, if not to help each other.
Hannah, why don't you pitch in here too?
Thank you. Yeah, I'll admit something embarrassing. I didn't know that until very recently that college students could run for local office until I heard about Joe Thompson, that Starbucks union organizer, who's running in the primaries, I believe next week actually, for state assembly. And I'm embarrassed to admit, I didn't know that that's a thing you could do. Is running for office a piece of what the student PIRGs are doing? Is that something that you guys include in your toolkit?
That is not something we explicitly train people for. So I will say that has been like a great leverage point for students over decades. You know, in Wisconsin, a student ran for mayor and, won, I think, in the 80s. And so just across the country, young people have had this tradition. And there are great groups that do support that explicitly. So, there are lots and lots of groups out there now that train young people and people in college to run for local office, state office, and for Congress, and provide support systems to do that. And I think that is a newer feature in the movement overall. But I will say that our program, although it doesn't explicitly train people to do that, offers young people a base of skills to do a whole range of things. So the mayor of College Park, Maryland, came out of the Mary program. The former city council chair here in St. Petersburg, Florida, was the chair of the University of South Florida chapter in the 90s. But it's not just elected office. And when I, look at the folks at the Sierra Club or the NRDC, there are alum everywhere. And I think that's one of the powers of this training program is that folks end up, taking on leadership. But beyond that, even I have, alum who worked with us for a year as students who contact me and go, hey, look, I got my, school board to do something. And I never would have thought that I had the power to do that or had any idea of how that system worked if I hadn't gotten my city council to pass that resolution when I was a student. Thanks for training me to do that. So I think our program also just trains young people to take action in their communities, even if they end up being an accountant or doing something completely irrelevant to politics.
And that's a wrap. Join us next week on the Ralph Nader Radio Hour when we welcome climate champion Bill McKibben. Until next time.
Stand up, you've been sitting way too long.